Well, good afternoon to you again, and welcome to another special edition of Litter Media Live. I'm Dan Ramey, and I have ladies from the Hope Clinic of Ross County getting ready for the Kentucky Derby Party at the Chillicothe Country Club. We've got scrolling information up above there where you can learn more. You can also scroll onto with your smartphone right there to the QR code that you'll see beneath our screen. So if you want to find out more details, we're going to give those to you coming up in just a moment. Our interview is brought to you by Rathkamp Financial Services.
At Rathkamp Financial, we offer customized investment solutions and superior client service. We believe in long-term relationships and working to earn your continued trust. Our greatest satisfaction comes from working with clients for many years and helping them realize their dreams.
Once again, we have, like I said, a group representing Hope Clinic of Ross County. And to my left, my immediate left, is Chris Adams. We also have Dr. Jennifer Allen. And also Melanie Loftus. Thank you for coming in today.
Thank you.
Thank you for having us.
Let's talk about this. First of all, the Kentucky Derby Party. We'll get more in detail on it here shortly, but let's at least let people know when it is, where it is, and the inner workings of how they get involved.
Kentucky Derby Party is...
Slide up to that microphone there.
Kentucky Derby Party is our largest fundraiser of the year for Hope Clinic, and it is May the 6th at Chillicothe Country Club, and our doors will open at 4:30. The festivities will start about 5:30, and then it'll just be a night of fun, and we have silent auction, live auction, delicious dinner, lots of games and fun, pictures with a horse, and we hope y'all can come.
Yeah. Are tickets available now?
Yes, they are.
How do I get one?
Well, you can, the QR code you just put up there. You can buy tickets at Julie's on Paint, and you can come to Hope Clinic actually on Monday evenings. I'll have some tickets there available. You can go to Eventbrite, just go to hopeclinicfree.org and Eventbrite, and you can purchase your tickets there.
All right. I've been involved with promoting Hope Clinic for a number of years. You folks have been far more involved than I have. Dr. Allen, if you could explain to folks, maybe they've never heard of the Hope Clinic before. Talk about what it is that Hope Clinic does.
Well, Hope Clinic really grew out of the dreams of Jamie Easterday and Lana Uhrig. We started working back in about 2010. Their idea was to have a free clinic available for our community, for those people who are uninsured. We seemed to have a gap at the time, and at that time we had about 17% of the people of Ross County who were uninsured. So they didn't have insurance, they also didn't get any aid. Those were the people we were aiming at. And Jamie and Lana spearheaded this thing, and it's been in existence now. We opened our doors January of 2012. I think it was January 11th, 2012, with just so much work by so many people in this community. And you've been one of them that's been there since that very beginning. And it was something that we felt that was very needed. We didn't know if we would be able to really have this dream become a reality, but we did with the help of many. Adena Health System, United Way, just so many different community activities and organizations that helped us open the doors. One of the lady who was the head of United Way at the time, Mary Elsis, was very, very involved and quite a cheerleader for us. And she said to us at the time, you know, dental is what we really need. And we said, yes, Mary, we know we need dental. We've got to get medical under our belt, and then we'll see what we can do. Well, with God's provisions and just very important volunteers stepping up, within 18 months, we'd also opened a dental clinic. So we now have a medical clinic, a dental clinic. Probably about 7, 8 years ago, we started a mobile market where we have food that's given away 2 times a month. And the big, kind of the crowning event has been the pharmacy that was opened a year and a half ago, I think, And Melanie was one of the people who helped us bring that to a reality. So we're very proud of those those 4 things that make up the Hope Clinic. And again, it is for the uninsured. And we serve those people who are 200% of the poverty level or less. You don't have to be from Ross County either. We have been able to serve those people who come from the surrounding counties most all the time. I don't think we've ever turned anybody away because of their geography.
I think it should be noted that while there are volunteers that help out that are just regular Joes, there are professionals who donate their time voluntarily to step away from seeing patients at the hospital or wherever their office is and coming here to serve on a Monday.
Yeah, everybody that's there on a Monday night is a volunteer. Yeah. We have nurses, we have physicians, we have physician's assistants, we have nurse practitioners, we have pharmacists, hopefully plural most nights, but many times just one. But Mark Unger has been a big help to the pharmacy also. So we do have volunteer pharmacists. So you're exactly right. They come to the clinic usually after working a full day and give of their time and their talents to help the neighbors in our community.
Yeah. I know as a physician, you probably take a look at the patient and everything, and then you have to think, well, they need medication. And that's where the pharmacy comes into play, right?
Yes, it has definitely, when I kind of first started volunteering and presented it like, hey, someday I want to do this, I was just immediately met with, oh my gosh, we have the need, like that's now, like let me put you in contact with some people. So it just, people at the clinic really felt like they were doing so much to help the community, but there was still that lacking, like we see you, we want to treat you, and we're sending you on your way with these prescriptions, but can you get those at this point? So it really just moved super quickly with the pharmacy, and it's been growing ever since.
I would have to think that it's quite helpful having the pharmacy there because you know that they're going to get it filled, the prescription that they've been handed.
And the pharmacy is available not only to our patients at Hope Clinic, but also to other members. And I would say probably 50% are from people who are not actually patients at Hope Clinic, but they meet the criteria for the pharmacy. So they bring their prescriptions from their physicians to the clinic, and we fill those.
Yeah. It's an enigma. We were talking before going on about the expense of prescriptions, and if you don't have insurance, man, you'd probably go without, don't you?
Definitely, and we also see the pharmacy is actually able to see people with insurance as well that just are not able to afford their copays. So we can kind of see a broader selection and are able to help a lot of people. I think people really don't realize that they qualify, which is they think, oh, like I make decent money, I'm not going to qualify for this. But we see 300% of the federal poverty level and with insurance or without. So, I mean, for one person, you can make $21 an hour and we can still help you out at the pharmacy. I mean, a family of four, it's $90,000 a year. A lot of people qualify that do not realize it. So we just want to get the word out.
Yeah, it's a little bit confusing. Our medical criteria is 200%, but our pharmacy is 300%. And we are able to help so many people that way. We were very lucky with Melanie. Melanie brought this to us with a whole business plan. Again, I mean, God just brings such blessings, and it's one of those things where you do the thing for the medical clinic, you do it for the dental clinic. With that, we also had a volunteer, Melissa Ward, who came to us and said, I've done this before, I know how to run a clinic, I'll help you get it set up, and she did. Melanie brought not only the expertise of the pharmacist, being a pharmacist with it, she brought a true business plan to us that could be presented to organizations for grants, all those things. She was working. These women who do this are just amazing because Melanie was not only a mom, a full-time pharmacist. She was working on a business degree, I believe, at the time. So these are women who are, and men, but are the two that we have think about. We're really overachievers in wanting to still, after all that they do, still glorify the Lord and help those who are in need.
I think that stands to be mentioned as well because we look at the hospital, it's started by a group of ladies that were Christian believers, and it's still the same today. But in that respect, in that aspect, the Christian part of this, this is a ministry that people don't seem to understand sometimes, that, oh, that's part of this too.
Yeah, our mission is we are a faith-based ministry.
Yeah.
And that really has been the balance and the support for everything we've done.
Yeah. The old Good Samaritan story. I can see it right
Loving
playing
God,
out before us.
loving others. That's been our motto from
Exactly.
the very beginning.
So let me ask another pharmacy question, if you don't mind. I assume, are the drug companies also helping? Do they give us breaks and things like that to help?
So we do utilize a few programs that, so Merck is a company that we have a contract with that we can get medications from them. So they provide brand name medications. With different companies, there are different stipulations. So with their medications, we can only dispense those to uninsured patients. So we just have multiple inventories just based on where we get the medications on who can receive those. So it makes things a little bit complicated, but we definitely have a lot of sources of free medications, and we also purchase a lot of medications.
Yeah. Anything worth doing comes with challenges.
Yes.
So
And from the beginning, before we were even able to have our own pharmacy, we had a Med-Assist program, which is part of different drug companies, and they will provide up to a year a brand name medication for patients who qualify. And we had people in our office, in our clinic, who would do that and go through all the work. It's kind of a hassle, but you get a free year of medicine, so it's been worth it. We still do some of that. We'll use anything we can to get the patient the prescription in hand to take care of their problems.
Chris, for those who don't know,
Yes.
Jamie is your daughter. And it's got to be extra special for you to be involved in a project that your daughter helped spearhead.
Yeah, she always says, Mom, no matter what I get into, you're my largest cheerleader. Of course. I remember when they started at Adina, and Jamie was like, yes, I want to start a free clinic and a free medical clinic. And Lana and I have talked about it, and we're going to have a meeting at Adina, and I want you to come and take notes. And that's where it started.
And it has
at
not
Adina.
ended. Chris is the note taker at
Yes.
every meeting, every organization, everything that happens. Chris is our person.
I'm the minute taker. So, you got to take the meeting minutes. So.
That's good.
But yes, I'm very proud of her and proud of Lana. And Lana's like a daughter to me. And yes, both of them. And I'm proud of everyone. This girl over here, she puts so much time out, and Jennifer and just the whole crew. And I'd like to say also, we had mentioned, pharmacists and dentists and doctors and so forth, but there's something at Hope Clinic for everyone. I mean, like I do registration, and we have hospitality, we have people for the prayer team. So there's just a little bit of everything out there, but we do need volunteers. So, if you're interested in helping, with the ministry or helping with, give back to the community, Hope Clinic, we'll just take you right in and show you what to do.
And Jamie, who couldn't be here, unfortunately, she wears too many hats. She's a very busy girl. But she sent me a note today, and she wanted me to be sure and to talk about our needs at the clinic. And we are in need of volunteers all the time in every field, but in particular, we need nurse practitioners, we need physicians, we need dental assistants, and nurses. And Melanie, you have a list.
Pharmacists, pharmacy technicians, and really we can utilize any help in the pharmacy because, like she said, we do still do those Med-Assist. That's a lot of paperwork for these patients. We do need to help with that. So anybody, we could use any help.
Yeah, it's fantastic.
The mobile market, if you don't think you like being inside for that time to volunteer, we do a mobile market on every other Monday night in coordination with Centerpoint, and it's held in the parking lot of Shawnee Center, and so that you can be outside and see lots of different people and do just serve a lot of people there on Monday nights.
So remember, the clinic is in Central Center.
The clinic is in Central Center, and
but
that's where
the food is over at Shawnee Square there in that center. Okay, very good.
Dental, medical, and pharmacy are all at Central Center.
Right. You mentioned a moment ago about Jamie wearing too many hats. Let's get to the hats because that's part of the Kentucky Derby.
Yes. Oh, yes. Yeah, this year we will have a well, every year we've had a hat contest, but this year we have named the hat contest Deb Turvey Hat Contest. And a lot of you out there probably know Deb Turvey, who just gave back to the community and passed away last year. And and she always wore hats. I mean, she wore hats to church, to, events, and everybody knew that Deb loved hats. So we named our hat contest Deb Turvey Hat Contest for this year. And, everybody dresses up for the Derby. It's such a wonderful event. And I'd just like to say that the clinic operates off of fundraising and grants and donations. So this fundraiser is very important. Like I said, it's our largest fundraiser of the year. So, and it's going to be fun this year. Dan's going to be there. He's going to be our nuncie. And then Mike Haller is our auctioneer. And, we have several tickets to sell, but we're doing pretty good. So, just get your tickets, like I said, on the QR code that is on the screen. And Julie's on Paint. They always sell tickets for us. She's just wonderful. And or you can go to Eventbrite. So, but it'll be a fun night. So,
and whatever you give to us through the Kentucky Derby, through personal donations, the churches. I have to mention that we have had founding and member churches since the very beginning, also, who are a very important part of spreading the word and helping us with Hope Clinic. But Jamie sent me information this afternoon saying that our total return to the community for 2022 was $1.2 million. So we're very proud of that. Melanie, I just spoke with her, and our numbers for the pharmacy are constantly growing, and I was surprised if you could share what our pharmacy has done.
Yes, so when we started out, the first quarter that we were open, we filled about 200 prescriptions, about $50,000 worth of medications. And then in this past quarter that just completed, it's about 6 times that. So we do about 1,200 prescriptions, $300,000 worth of medications we dispensed last quarter. It is definitely growing.
I think 3 words: praise the Lord.
Yes.
The information right there.
Absolutely.
we say this is God's clinic. Yeah.
Hope is in there, and there's only one hope, and that's through Jesus in that respect. Anything that we have missed you wanted to make sure we got across today?
We'd love to have you volunteer with us. We'd love to have you come and have fun with us at the Kentucky Derby, because it really is a lot of fun. And I do want to mention, in all the things Chris said, we do watch the Derby. Yeah. This year we're going to have a big screen TV there to watch the Derby. It's actually going to be one of the silent auction items, but we do watch the Derby. There are people there who are interested in the Derby, and we do watch the Kentucky Derby.
And also sing My Old Kentucky Home.
Oh, yes.
We do that.
Make sure you do that as well.
Yes.
So.
And we have, there's just so many, I can't mention all of them, but we have been blessed with a lot of sponsors, a lot of people who have donated auction items. We have a live auction, a silent auction, and we've just really been blessed there. So, and they will be recognized on our website. But yeah, and we sure appreciate that also. So.
This, it might be the longest we've gone without Chris taking notes. So how about that?
She's got it in her head.
She'll be jotting them down after we get done with this.
I'll write it down as soon as we leave.
Ladies, thank you for what you do for the community, and thank you so much for coming in to tell us more about what's going on with Hope Clinic of Ross County. Again, if you want to find out more about the Kentucky Derby, just click on that QR code right there. And, of course, just check out Hope Clinic of Ross County on Facebook. You'll find the event spot there as well. I'm Dan Ramey. Thank you for watching Litter Media Live.